as the signing ceremony just been concluded, where Global Fund just offered over 8.8 billion rand in the fight against HIV and AIDS, tuberculosis and malaria. And of course, during the course of COVID-19, there were some losses that were experienced in this regard. But joining us now is South Africa's Health Minister, Dr. Phaahla. Minister, thank you so much indeed for your time. Obviously, you placed a lot of emphasis around accountability when it comes to these funds and making sure that the intended beneficiaries do get the assistance that they need.
Well, that's very important because this is a major contribution to our fight against HIV, TB, and malaria and sexually transmitted diseases. But, you know, these are public funds because these funds are from donors. Some of the donors are governments, including our own government. As you would have heard that the US over the last 20 years have contributed just over 20 billion US dollars. France has contributed just over 8 billion US dollars. And so have we also, and various governments. So an additional resource of just under 8.8 billion rand for the next 3 years. It's a very significant injection into this, and it's very important that ourselves as government, the Department of Health on behalf of the South African government and the other non-governmental organizations, which are the implementing agents, we must really be very scrupulous in managing the funds and making sure that they reach the beneficiaries who will actually have the impact of what the funds are intended.
One of the major concerns, Minister, the World Health Organization spoke about the regressions because the focal point was around COVID-19. As South Africa, because we know that in terms of the HIV patients, we still do have that significant number. Did we see any severe impact and the adverse impacts in this regard?
Well, definitely. In our 1990 commitment to the United Nations AIDS, to UN AIDS, we were already, in terms of those people who are HIV positive knowing their status, we did retain the 90, almost 91 at times. Where we suffered is retaining people on treatment and even starting on treatment. We're already in the mid-80s, 83, 84, and then we slipped back to about 76% of people who know their status actually either starting treatment or retaining on treatment. We lost some of the clients from follow-up in terms of treatment. The same with the tuberculosis. So that's really, these funds are going to come very handy in terms of closing that gap, which came as a result of lockdowns, when people were not visiting health facilities, either because they were closed or not really. We never closed health facilities, but simply because, you know, the focus was more on turning most of the facilities to deal with COVID, but also just the fear that many people were fearing that if you go to a health facility, you may get COVID. So those are the kind of setbacks we had over the last 2 years.
And Minister, what do you say to encourage them to go back and resume the treatment?
Well, we want to say that it's safe. We've learned a lot. Even as I say, we never actually closed health facilities, but there are a lot of inconveniences in terms of how health facilities were organized at certain levels of high levels of COVID. But now we've had a lot of experience. We're making sure that the COVID work it does not interfere, and people will not really end up standing too long. They must just come back. It's very important. It's life-saving that those who stop taking their treatment must come back, and those who know they are HIV positive, or there might have been contacts of people with HIV or TB, come and be tested so that you can start on treatment.
And obviously, Minister, we've seen the Cabinet is concerned about the rising cases of COVID-19 with all the subvariants that we see. Any just word of caution to South Africans?
Well, as we've emphasized all the time, that we think we've made progress in the fight against COVID. We've learned a lot. Many people have come forward to vaccinate. Just under 20 million people at least have a jab. We have administered just over 35 million doses. We would have wished to have reached 70%. We're just under 50% of the adults. We have made a lot of progress.